think it's hard to be in a system that's not working. I think it's frustrating for the doctors. I think it's frustrating for the patients. I think it's even frustrating for the people that run insurance companies and for business leaders and for hospital executives. I think we're all caught in a system that's not working well, and we're going to have to say, okay, ready, set, go, let's change.
And do you think, I think a lot of people think hotspotting is the answer.
It's not the whole answer. I think it's just a small element of getting people's attention to focus on sick people. You know, hotspotting is not geography. Hotspotting is segmentation. It's taking big data sets, segmenting them into strategy so that you can target different pockets of need. And one segmentation can be geographic, but you can come up with whole different segmentations. When you build a great program to deal with very frail elderly patients, that's hotspotting. When you build a great program to deal with babies who are coming out of the NICU, whose moms and families are overwhelmed, and you want to keep that baby from getting re-hospitalized, that's hotspotting. Hotspotting is making sure that people who are in need get their needs met, but you do it in a rigorous, data-driven way. For an average primary care doctor, you make more money running from room to room to room treating head colds than you do treating really sick patients. When you walk in the room of a patient that's been in the hospital recently, that has a lot of complexity, that have had their meds changed, their family has a lot of questions, that slows you down. And you can't bill proportionally more money for that to make it worthwhile. So the idea that family doctors make more money treating head colds than sick people is crazy. But on the other end of the system, if we can cut scans out and hospitalize them, then we make a huge amount of money. So, you know, that's cruel almost. That's a system that sets the doctors up to fail, it sets the hospitals up to fail, and I think it sets the patients up to fail as well. So there are a lot of innovations occurring around the country to rethink how healthcare services should be delivered, and I think those innovations are very exciting, and I think we need to share those stories with patients and business leaders and religious leaders and political leaders, so we can begin reimagining what we want to buy. And then put our foot down and say, we're not going to keep paying for the kind of care that we used to get. We want a different kind of care. We still want the high-tech care, but we also want high-touch care, and we want coordinated care.